So excited to have Dr. Brian Hollett, the Chief Medical Officer of Shift Life out of Chicago. Thanks for joining today, Brian.
Yes, thank you so much for having me, Sunita.
Well, I loved our conversations and think you are a very forward thinking doctor when it comes to how you integrate and start to use AI. And so excited for you to share with us on this edition of How I AI, Clinician Edition. So how are you using AI in your daily workflows today? In what ways is it adding value?
Yes, and when it comes to AI, I'm continually trying to ask the question of how can I use this as a tool to help me to perform at a higher level as a physician. So there'll be a few different ways that I use that approach. Kind of three big picture buckets. I'll use it to combat the fear of the blank page. I'll use it for some proofreading, and I'll also use it for some personalized content creation. So, on that fear of the blank page, I'll think about using AI to help to expand brainstorming when I'm doing it, to try to just bring in a broader array of possibilities or items I might not have initially considered when thinking on
Cool.
certain topics. I'll use it for instances where I want to do a really quick element of market research or a quick dive into a topic that I'd otherwise want to spend a handful of minutes on and be able to get as concise and deep of info as possible. And then
And do you have
lastly,
an,
on that combating the fear of the deep page, I'll be
yeah.
thinking about using AI to help to broaden my differential when I reach certain unique, rare clinical instances where I've exhausted most of the things I've initially thought of and looking to continue to ask what are some of those other rare or unique elements I might not yet have considered.
Makes sense. And for the first, awesome. So for the
Yeah.
first category of things of like kind of market research or the things that you want to spend 5 minutes on and no more, what's an example of something that's recently come up for you around that?
Yeah, I mean, on the market research side of things, one of the things I was looking into recently of, what is the relative density of concierge practices around certain regions? Just to better
Great.
understand in the domain of concierge medicine where I'm at, one of the unique things that will recurrently happen is someone I'm caring for will be traveling. They'll be in a different environment. And sometimes I'll need to know who and how could I tether somebody in unique, rare situations to someone else who's going to be able to deliver a high level of care. So sometimes those quick research elements can be insightful to see what is gained. And many times it is languaging that prompt, that query in a proper way to be able to create some of those elements and then sometimes pick up the breadcrumb trail to figure out where that final destination is for some of those more unique types of scenarios.
It makes tons of sense. Fascinating. And then cool. And so in those more unique scenarios and the ones where you've like exhausted like ideas, what in what way are you what information are you giving to your LLM? Are you using Chat GPT? And how do you mentioned to me earlier, you kind of scrub it for HIPAA
Yeah.
purposes and so what kind of information, what prompt are you using and what conversation are you having?
Yeah, if I'm using the large language model for kind of clinical reasoning element, I'll often use either ChatGPT or Open Evidence as I'm thinking through some of those different clinical tools from the AI side of things, and then obviously ChatGPT being a broad tool. I'll queue it up with the tactical facts of data around an individual, and then I will feed it with some of the insights that did not pan out. Of
Hmm.
here's why this initial diagnosis was excluded from a differential. Here's what we thought on this domain. And then end after that with the request, could you please create a list of other potential diagnoses that could be considered in a differential? And if possible, please rank order them in likelihood of diagnostic accuracy from most likely to least likely so that I can also see if the LLM is able to generate a list of 10 or 15 potential diagnoses, I know where to start rather than to approach
Awesome.
all 15 as the highest level of likelihood and use those as the springboard for my continued clinical dive.
Awesome. Awesome. So you're jamming here with AI and
Yes.
helping it kind of push your thinking along. Awesome. Okay. So super helpful. In your second category, tell us more
Yeah.
about how AI has been helping you.
Yes. So I'll use AI for the proofreading and editing of original content, thinking
Mhm.
through. I, as most human beings do, have an innate style that I typically write in, but depending on the modality and the audience that spoken or written word is going to be used in, I will create my content and then pass it through an LLM with the requests to please, proofread and revise for conciseness, and or oftentimes I'll queue up the large language model to ask, in the style of a specific author, how
I love
might
that.
this be revised? One of my favorites when I'm looking to create very concise yet powerful email content or really quick posts will be asking the large language model, could you please revise this in the linguistic style of author James Clear, who wrote the book Atomic Habits? And he's so
Right.
very skilled at cutting straight to the core of certain topics with very simple, direct, precise wording, and being able to use that almost stylistic approach of all that exists from him as an author and him posting online throughout different social media outlets to have that large language model apply some of that filter to the content I've created.
So powerful. I know that must save tons of time and also helps extend your capacity. You're running a very successful concierge clinic that's trying to come up with the content to keep people engaged, and whether that's marketing or probably informational things you're sending your patients, and to have a voice that you can quickly dial in and feel confident putting out there is powerful.
Absolutely. And the last way that I'll be using these large language models and AI in my day to day will be for personalized content creation. So there'll be many instances where I'll have encountered, as we're thinking about building out health building plans for somebody, I'll be sitting down with somebody and I'll think in my head, hey, we built out a good workout plan for somebody else a couple weeks ago that I think that core foundation would be really practical for this individual, knowing we don't have to do a total ground up rebuild. But the person I'm sitting down with may have different movement deficiencies. Say they're seeing physical therapy to rehab a rotator cuff issue that they have.
Mm.
To be able to input into the large language model, here's the workout that I previously built. Could you please revise the approach in this workout so that we avoid exacerbating this known physical ailment, but we still achieve the targeted goals, and
Mhm.
use that as a really quick tool to really have the large language model recreate the workouts with some small substitutions that I can then proofread. Because as so many experience when using large language models, it is far faster to refine existing
Mhm.
content than to generate content from scratch. So being able to
Mhm.
have that LLM create the sample workout in a matter of seconds enables me to be truly focused in on what does the final product look like and what should I tweak in that, rather than attempting to rebuild from scratch and think and take so much more time on a specific topic, knowing that the true goal and the true utility of the product is the usability as a fitness plan, or in a
Mhm.
similar parallel, if we're building out um, a nutritional approach that somebody should be taking, thinking through their personal likes, dislikes, certain food intolerances, certain allergies, into sculpting out some kind of broad brushstrokes approaches that they should be taking
Mhm.
to be able to, at the end of the day, one of the approaches we continue to take at Shift is we want to have health be an element that can be sustained with great consistency. So have something that can be created that feels as though the new routine fits with who they are and what they do in life, rather than feeling as though it's this stretch and this kind of draining exercise that they wouldn't be able to sustain.
And this ideal, yeah, love it. And you are using the expertise of your in-house team. You have, exercise, you have personal trainers, you have nutritionists, all these folks on staff, but they're just able to amplify their ability to personalize the plans for their patients with the help of AI.
Absolutely. It's thinking of just asking the simple question, even though we're able to spend many hours on site with our members when they come in, it's the question of how much impact and how much depth can we achieve in that still finite amount of time. So trying to continue
Yeah.
to ask, how can we leverage existing tools so that we as human beings can show up as our best with our
Hmm.
best to achieve our best, and thinking towards, rather than a fixed mindset of what have we done, having that growth mindset of asking how could we continue to improve, and by way of that improvement be able to seek even higher heights at even faster paces than previously would have been thought possible.
Phenomenal, phenomenal. Amazing. Well, those are some very specific, really interesting segments that are adding value today that anybody can go and start using these tools to augment their practice. So thank you so much for sharing, and excited to continue the conversation and see what else you're trying in another couple months. And so thanks so much for sharing with us today.
Absolutely. My pleasure as always.